does everyone have ADHD?
We all have characteristics, but that does not mean we meet clinical criteria for the diagnosis.
But we meet TikTok criteria.
We definitely meet TikTok criteria.
We all meet TikTok.
Everybody.
Everyone has ADHD.
Yes.
Explain the difference, because some people actually dismiss the validity of ADHD as a diagnosis.
Okay.
They're like, well, everyone has it.
And then some people inflate it the other way, and they go like, oh, I definitely have it. And I'll say, no, you're just disorganized.
So first of all, what is it that you have? Because there are 3 different forms.
Okay.
So there's hyperactive impulsive presentation.
Wait, hyperactive impulsive?
And what does that look like?
That looks like you are always on the go, Energizer Bunny. You keep going and going and going. You talk nonstop. You're doing 15 different projects. You are moving from one topic to the next. You're running when you should be walking. If you're a little kid, you're climbing when it's dangerous to climb. You're just acting before you think.
Can this be presented like, so I know with some people it's like the persistent tapping? Is that the hyperactive?
Okay, so that hyperactivity, okay.
Like their knee will be constantly moving, or they can't sit still in a chair for a while.
So people can be anxious and do that. People can do that to self-soothe. There can be lots of different functions of certain behaviors. So that's another thing. Like the tapping doesn't mean you have ADHD, but what you will find is that people with ADHD tend to be a little bit louder. They tend to move their bodies more. They tend to have difficulty being aware of like their bodies and that their bodies are moving. And that's sometimes just restless energy. But you can also see that for people who have like anxiety. Then you have the inattentive presentation, which is like space cadets. You are forgetting things, you're losing things, you're drifting off into space. You're supposed to be focused on one task, and before you know it, like bunny runs across your path and you're onto the bunny.
Yeah, but I mean, everyone should look at the bunny. I always worry about people who don't look at the bunny. If you're living your life and a bunny runs across your path and you don't look at the bunny, who are you?
Who are you?
What life are you living?
I don't know, but it's not a good one. And so you got hyperactive impulsive type, you got inattentive presentation, and then the third is the combination of all 3.
Oh, the big boss.
The big boss, which is where in some settings you're hyperactive impulsive, in those same settings you might be inattentive. And this is when you see people really start to struggle. And you have to have disruption in social and occupational functioning. What that means is this has to be negatively impacting your relationships, or it has to be causing trouble on your job occupationally, right? If you're a kid, you don't have a job, you have school. So what you see is difficulty like getting through a test, or forgetting to turn the homework in even though you did the homework, or losing the worksheets. With my kids that I work with, I'll have them bring the book bag in and it looks like a war zone inside the bag. But for adults, and I'll talk about myself, the house is organized, but if you open a drawer or you open the closet, it looks like
it's chaos.
Chaos.